and welcome to the Nurse Rosa's Insights podcast. I'm your host, Rosa Hart, and today joining me is Nurse Emily Will. Thank you so much for joining me today.
Thanks so much for having me. Looking forward to our conversation.
Yeah, we've been kind of orbiting each other for a little while now, and so I'm really excited we could make time to have a conversation to really dive into ideas. Emily is a nurse innovator and now an official clinical strategist in her official job, but she doesn't limit her innovation to her day job. You also do some volunteering on the advisory board for the American Nurses Association, right?
I sure do. Yes, I actually serve as co-chair of the Care Model Redesign Committee of the Innovation sort of advisory council. And in that role, work with nurses across the country to really, understand what care model redesign innovations are happening and how the American Nursing Association, or now the American Nursing Enterprise, can help to elevate that work, recognize the ever changing roles of nurses and how they can be leveraged across the health systems.
Yeah. And I just absolutely love that you don't turn your brain off when you are done with work. Like, this is really just an outgrowth of your heart for making things better and helping to make a healthier world, which is why we're here on this show right now.
Yeah, yeah, absolutely. I believe that patients deserve to have access to care, and I believe that nurses play a huge role in not only providing care to patients, but can be a huge um, kind of catalyst for improving access across our healthcare systems. So
Definitely.
my brain never shuts off.
Yeah, exactly. That's how I feel too. So, I noticed, I started connecting with you, before I think we met at Health and around the
Mhm.
Nurse Hackathon, right?
Yeah.
I think we had a selfie together at the hackathon, but we'd been seeing each other on LinkedIn a little while before that.
Mhm.
Um, so I haven't really known you over a year yet. So can you give me some of your background as far as like what has your path been like in nursing to now?
Yeah, absolutely. So I've been a nurse for almost 20 years. I can't believe I'm saying that, but we're coming up on that milestone. And, in that 20 years, I've spent the majority of my career in ambulatory orthopedics, both as a clinic nurse and then as a clinic leader. And through that role, always was the nurse that was tapped on the shoulder to be the epic super user or the, lead this project or do this pilot from a tech standpoint. And so during the pandemic, really stepped into our virtual, strategy kind of roles and how are we going to do care differently. Um, and it was the fall of 2022, and I was at Magnet and heard Olivia Lemberger actually give a talk about nursing innovation. And that was really the first time where it connected that what the work I was doing was actually nursing innovation. Um, and that talk kind of really gave me the courage to step in and step out of a traditional nursing role and into something different. And so I had the opportunity to lead a DexCare project. That's who I work for now. In my former role and roll out kind of online patient scheduling for our orthopedic urgent cares. And through that, really said, I really love what I've been able to do with your platform, how it's helped our patients to, find care, get care faster. It's helped us to fill our clinics that weren't necessarily full before. And so shortly after that Magnet presentation, had a conversation and they said, well, actually, we're hiring for this clinical strategy role. We think you'd be perfect. And so it was really, um, kind of that being able to see myself in the roles that I was doing as something different and something that was transferable to health tech and to startup life. And so joined DexCare. It'll be 2 years coming up here next week. And what a wild ride it's been, coming from traditional healthcare where I had worked in and around my organization for 16 plus years, um, and stepping into a space that in startup land, no 2 days are the same. Um, that you think change, it happens rapidly, and sometimes it feels almost a little chaotic when you're coming from a healthcare system. It definitely is a major shift, right? Change inside of a health system can take months, if not years, and in in health tech, we can make changes in days and sometimes hours if we need to pivot to meet our customers' needs. And so, um, have really been able then to blend what I do from a care model redesign and where my passion is there for team-based care, and really help to influence how our product elevates and leverages the entire healthcare team. And so, really, it is kind of that meshing of the tech, but with the human side of healthcare, where we're really truly amplifying what the work that the healthcare systems are doing that partner with us, from leveraging their apps to leveraging their registered nurses to deliver virtual care with existing protocols, to how do we make sure that the patient that is seeing the neurosurgeon who specializes in deep brain stimulation is only seeing those patients, right? Or the orthopedic surgeon that is a sports medicine knee doctor is only seeing those knee patients. And so, um, I feel like I get to take my kind of passion for improving healthcare access and leveraging the entire team and bring that to my day to day in my work. And so I feel lucky, to be able to do that.
Yeah, that definitely makes it more fun. It's like an adventure.
Is yes. Plus, I get to connect with amazing colleagues in the space and attend health conferences and continue to just learn and absorb as much as I can. So,
Yeah. So, what exactly is the product that you were piloting or
mhm.
trialing with DexCare
Yeah.
that brought
So,
you into the company? And is that what you're working with now, or is it something different?
yes. So it's a little bit of what we do today. And it is still one of our core products, which is really, so DexCare is a care orchestration kind of digital front door company that partners with health systems to provide not only a virtual care platform, but scheduling for, kind of retail or same day care venues. So urgent cares, walk-in clinics. That's the product line that I utilized for our orthopedic urgent cares, was really to get them online schedulable and to be able to surface available spots, with some of our our traditional walk-in clinics. I was able to leverage some of our APPs that were at some of our smaller clinics and had capacity, and leverage that open capacity to see patients as well. And then we also offer a product called Omni Search, as well as some fast pages that improve performance for their health systems at Google, so that their pages rank higher and they can organically attract more patients. So, it is a little, I think DexCare has evolved since my time with them at the midst of the pandemic. But it's incredible to see the power of utilizing the entire care team. And by care team, I mean not only just the nurses and the doctors and the APPs, but also leveraging the different sites of care at our health systems, virtual, or, directing patients to the urgent care when they have a fever instead of waiting 2 or 3 days to see a primary care provider. We're able to cut down and help patients to see providers much sooner, whether it's minutes for virtual care, hours for, that same day care, or, seeing days reduction in a time to a physician appointment or APP.
So, what is it within the tool that helps with like the prioritization? Is it the self scheduling because patients are able to identify their needs from like a drop down menu? Is that what you're describing? Or
So it is a little bit of that, but it's also in our search. So, with our search, our clients are able to help us to identify which locations and which providers they want to surface. So one of our clients, they have routed and made the decision that if you type in sports physicals to their search product, that it will surface their same day care venues. They don't want those sports physicals clogging up their pediatrician's office. If you think about sports physicals, right, they're happening most often in the summer months when those quick care locations aren't seeing as many patients. And so it's really about how can we leverage those existing assets and how can we surface the most appropriate result first.
Yeah.
Then, once we've surfaced those most appropriate results, we actually cross sell. So, very much like you would see on Amazon, when you click on the red ball, and maybe that's a 3-day wait, but there's a black ball that is, you can have it here by 10 a.m. tomorrow. Great. It's the same product, it's just a different color. I'm going to hit and order that black ball so it's here. Um, so I think it's a it's an interesting concept for healthcare because traditionally we've really thought about it as like the patients are coming in, they want to see Dr. Smith, they want to schedule with Dr. Smith's team. And what we have found is that oftentimes patients are just searching for care. They just want to be seen quickly by the most efficient provider. It doesn't matter if it's virtually, it doesn't matter if it's in a retail location or if it's with a primary care provider, as long as it's convenient and at a time that works for them. And so by having those options and not having to restart a search when you don't find, Dr. Smith doesn't have availability or they're not scheduling online, we might have Dr. Smith's APP that is on that same page that does have availability today. And so,
Know that name to search it, so they would need to
correct.
have it as a suggested option, but and it might be a different APP than they might have seen last time, right?
It
Yeah.
exactly. Or it's that location that's, maybe it's 5 minutes more down the road in the case of a retail clinic, but I can get in 30 minutes instead of 3 hours from now,
That's
and
what
as
is
a busy working mom, that matters to me, so
exactly, yeah, when it's urgent, like, you need it that same day, like, if my kid is staying home from school and, like, I call and I'm trying to get them in to be seen at the primary care, and they're like, "We can't see you for a month because 'cause we're slammed." I'm sorry, my kid is home from school. I need a doctor's note for today, you know?
exactly,
It's
right?
not gonna help me 4 weeks from now. He better be better in 4
Ye
weeks.
and if he's not better in 4 weeks, we probably have a whole different problem, so
Exactly.
yes.
Yeah.
Yeah, absolutely. So, I think it's really
Availability
just that,
too.
like, shift of mindset, that we're seeing with kind of healthcare across the board, this idea that patients are consumers of healthcare, that they have options today more than ever before. We've seen, kind of the rise of virtual care, and then it's kind of settled out, and I think it's kind of found where it works best, but we still need to be able to surface those virtual appointments and help our patients to know when a virtual appointment is actually okay.
Yeah, exactly. And I mean, I hope there is better clarification as we go forward as far as reimbursement for those virtual
Mhm.
visits because so many people really need those because of transportation issues and location issues. Like they just live too far away. Um,
Absolutely, and I
so
think it can be
obviously, there are
it
things you have to test for in person,
yeah.
right? You can't like swap somebody for a strep test over a virtual call, but you know.
You can certainly have a follow-up visit for,
Mhm.
test results, or
Yeah.
you can be seen for that headache or that, GI symptoms and at least get the symptom management. And if it doesn't improve, then you may need to be seen in person. But oftentimes it's just connecting with that provider that has the knowledge and the reassurance that you need often in those low acuity settings.
Yeah, for real. Yeah. And then how have you been bringing your expertise, and leadership from that to organizations like the ANA's Innovation Council that
Yeah,
you're part of?
that's a great question. So, um, in my life as a clinical leader, I, during my master's thesis, really embraced the idea of team based care and what that could look like in an orthopedic practice. So, leveraging my nurses differently for pre op education, for, certain post op visits, if the physicians were on board with that, to free up their APPs to see new patients. In our orthopedic clinics, we started to leverage our athletic trainers in a different way, having them be in the physician clinic, seeing patients along with the physicians so that the physicians who were utilizing their APPs really as just like a physician extender, we could free those APPs to have their own clinics. The athletic trainer stepped into that kind of extender slash scribe role. Um, and then, leveraging the medical assistants in a slightly different manner as well, focusing them on, you know, how can we efficiently and effectively room? How can we help them to, really feel like they're actually a part of the care team? And then also enabling some surgical schedulers in our orthopedic clinic, as well as, elevating kind of that scheduler role and clarifying roles so that people knew exactly what their core responsibilities are. I think that's one of the golden nuggets of team-based care, and it's something that I feel very passionate about is, understanding what is top of license for each role that you have in your care setting. How can we leverage their unique experiences? How can we help to make sure that the team is working effectively, right? I come from an athletic background, was a Division 1 athlete in track and field, and so, on a track and field team, right? Like we didn't win conference championships because we had 40 throwers. We won because we had 2 or 3 throwers and a whole bunch of distance runners and sprinters and jumpers, and so each of us had our unique role to play for the team. And I don't think healthcare is any different than that. And I think as we think about the care model and how we deliver care today, right? We know that the way that we've historically delivered care in this country isn't working anymore. Patients are waiting on average 26 days to see a primary care provider across this country. They're waiting hours. We are boarding patients in emergency rooms to be admitted. We can't get patients out of the hospital to skilled nursing facilities or rehabs because we don't have beds. We're looking at piloting hospitals at home, and what does that mean? And how do we have the staff and how do we have the tech that supports these changing staffing models? And so those are the kinds of ideas that I'm able to then bring to the ANA, but I'm also able to see what our health system partners are doing that's different, right? And one of my favorite things is when we meet with our health system partners, usually on a quarterly or biannual basis, we're able to kind of take what's working really well at one partner and help to bring that to the other and say, here's what health system X is doing. We think if you made these few tweaks, we could see this. Last week we were talking to one of our partners, and they were like, these cross sells are amazing. And I was like, yes, imagine if we took them to your specialty clinics, right? Like, let's think about orthopedics. One, it's near and dear to my heart, but two, like, most of the searches that we see, a vast majority are for orthopedic conditions. So what other options can we surface up? Can we surface up your physical therapy clinics? Do you have direct access PT? Do you have an orthopedic urgent care? Do you have like a, online kind of access platform to get those patients in? So it's really about, bringing kind of all of the things that are being trialed across this country, bringing that to the ANA, but always keeping a focus wherever I am on the role of a nurse and what we can do to continue to transform and elevate care today.
Exactly. And I think that brings us to the $1 billion question, which you've probably referred to throughout all this, but you feel free to surprise me, okay? Don't limit yourself. Um, if you were, Emily, given a grant for $1 billion to meet the needs that you're seeing in healthcare, how would you like to see it used strategically to have the most sustainable impact?
First off, I love this question and I wish I could have $1 billion. But how I would go about spending that $1 billion is really on, care model redesign, elevating team-based care in every healthcare setting, empowering nurses to step into their role as coach of these teams. I believe that if we change how nurses are positioned within the healthcare system, and change the it from being the order taker or the order doers to actually the order givers, that we could really shift and improve patient care. I think nurses often have a very unique perspective in the healthcare system. We're taught to see the entire person. If you think about nursing care in the hospital, it's the nurses that are with those patients 24/7. They are getting nursing care. In in my nursing training, I had a professor, Dr. Mary Beth Gosling, who was one of my very first nursing professors. And I always like to say she was wise beyond her years, but she was definitely, one of those older professors. And she
Like,
said
"Oh, are
to
you
all
wise
of
enough
us,
for" it was like she's wise enough to be a 200-year-old person.
exactly, right? And she would say to us, now remember, these patients are not in the hospital because they need doctor care. They are here for your care as a nurse. And so that is something that is one of those little nuggets that's, tucked away that I really think is at the heart of my passion for team-based care and why I believe so strongly in its ability to transform healthcare. And I think it comes from, leveraging the unique experiences, the assessment skills that nurses have, the intuition that we often have to know when to pull in the next resource. And so if we think about ways that nurses, when they're elevated to, roles where they can help with care coordination, where they can help with, the logistics, right? I think we've all probably seen Nurse Dana on the pit right now. And if you
I
haven't, you
was
have
just
to
waiting.
go
Oh,
watch her because
yeah.
she is the example of a nurse as a coach, right? She has the game plan and she is directing her players. She knows each of her players' strengths and when they need that supportive talk on the sideline, when they need a swift kick in the pants to get back out there and to keep going. And she also is like that steady voice when it is utter chaos that with her eyes can connect and calm an entire room. And so if we utilize her as our model of what a nurse as a coach looks like, I think you can see the power of what that would look like across our country if we elevated our nurses to coaches in a team-based care model where they are the ones that are pulling in the right resources, whether it's a social worker to help deal with, social determinants of health, or it's the physical therapist to help with mobility issues to safely get someone home, or it's the resident to give them that experience. Or sometimes it's the coach saying, "Hey, you need to go home." Right? Like, you shouldn't be here. Like, you're tired. I'm pulling you out. And, I think that is something that we also need so much in nursing is the ability for leaders and nurses as coaches to not be afraid to say, "Hey, I'm worried about you. I'm concerned. I see the burnout. I see the stress. You need to take a time out and we've got your back. The team is here for you." Right? Like, we need those kind of environments.
I really do. And I'm so glad you brought up Nurse Dana because I was just waiting for you to pause so that I could ask you about that. I was like, so if you could envision that in media, it's just so perfect. Like, how often do you think of an example of how healthcare should look and you're like, "Oh, like on the TV show I've been watching, they never get it right until the pit. Here we
The
are."
pit has gotten it right. And, and I think for nurses, so many times we have, and I think we're all guilty of it too. I think about how we portray ourselves on social media, how, like love Nurse Blake, but like, I don't know that he necessarily encourages the next generation of nurses to want to be a nurse, right?
I mean,
And
there was a whole lot of negativity, but, I actually listened to his interview with Dr. Mike. Did you see that on
no, I
Dr.
haven't.
podcast? So Dr. Mike, you can thank me and also come be on my show, because I'm plugging your podcast. But, yeah, on I think it's called The Checkup, but, it was doctor versus nurse, not really. It was very collegial. But, I was really impressed with the conversation, and it sounds like, he's really trying to make things more positive, but also productive. Like, I know
Mhm.
on the last cruise that they just had, he had Kaylee Dayton come speak on it. Do you know who she is?
I do know who she is.
Because I'm sorry, if there is a nurse innovator who is too legit to quit, it is Kaylee Dayton.
It sure
And
is.
she has started the healthcare revolution that is early mobility in the ICU. Yes, I know she didn't like start it for real, but she's the one who's pushing it and making it a movement and getting the word out and the visibility that if you're on a ventilator, you need to not be sedated if at all possible, and you need to be up and moving as much as possible. And she got to teach about that on the Nurse Blake cruise. So this was not just like some wild party.
Right.
They were legit talking about how to make healthcare better, and if that doesn't take you out of a funk and into, I'm going to be a revolutionist and make a difference in healthcare and give you hope, I don't know what will.
I think the same can be said about health and the experience of being surrounded by 300
Right.
nurses that have a passion to make healthcare better. And I
And
think as
the nurse
long as we're all
hackathon.
leveraging our voices in a positive manner,
Mhm.
that that is where the impact comes from. And nurses as, the largest healthcare profession, it's time for us to leverage our voices, and
Yeah.
it's time for us to stand up and to be nurse Danas, right?
Right.
But also let's not go without acknowledging the, frontline violence that we saw against Nurse Dana in the pit, right? I mean, it is a harrowing thing to see, but it is an all too common occurrence. And so, we need to recognize that. We need to recognize how hard it is. But I think that that's part of nurses as coaches and being able to leverage them to see each other and to support each other. Um, and to be champions for the innovation that nurses do each and every day, that they don't think about it as innovation, right? Like, I had changed how we were delivering care, and I never thought about that as an innovation until I listened to Olivia give that talk. And that was really kind of that, like, light bulb moment that, gosh, maybe I am a nurse innovator.
Right, and as you were talking about, but that's what you're bringing to that advisory council. I think a lot of the time we think of innovation means like invention. Like you see the light bulb and you think inventor. Like, am I developing a device or some kind of patent? But you're talking about process improvement. You're talking about care pathways and the ways of doing things. Like, I love that so much because it's so big picture. This is not just one device. This is like a framework that can then be implemented in lots of different areas. So, thank you for describing that and for putting into words that innovation is not just inventing things you can see, it's
Mhm.
building inventions that might be intangible, but they have very tangible impacts.
100%. And I think there's lots of theories out there, right? And sometimes it takes applying that theory in a different way to drive a different result. And I think being able to, like, measure results, see the results, what does that mean, right? Like, my physician satisfaction when we made the switch to these team-based care models went through the roof. For the first time ever, we had one of the physicians who, as a young nurse, I used to be in clinic with him until 7 o'clock at night. Like, it was a really long day. And through some of these care model shifts, we were able to get his care team out of clinic by like 5 o'clock every day. Like,
That's
that is life
amazing.
changing for those
Yes, it
nurses
is.
and for his APPs. Like, those are real tangible ways. And it was really taking something that I was learning in my master's classes and being able to take and apply that in a way that worked for our clinic set up. And I think it's leveraging those principles, but not being afraid to try something new. And that really is innovation for me. And I think sometimes, like you said, we think of innovation as like it's got to be something like that we're going to take to market and it's going to be a product. And sometimes it's really not that, but it's a different way of delivering care, right? That can be as innovative as anything. One of our customers likes to tell the story that no one ever thinks that physician payment models are innovation, but switching from a worked RVU where you're getting paid, for every patient you see, every procedure you do, to more of a panel model where they're truly kind of a salaried employee, and what that's done for their access, like, that's innovation and it's transformation, and it's been life-changing for patients because it knocks down the silos that we know exist where you can't, you know, see Dr. Jones if you're Dr. Smith's patient, and in a model where you're on a panel, it's just about making sure you get the care you need.
That is beautiful. Well, thank you so much, Emily, for sharing that with us. And how can people get a hold of you if they want to talk more about these big ideas?
Yeah, absolutely. I am an active LinkedIn user. That's probably the best place to connect with me. I'm sure we'll have that in the show notes, but would love to connect with you there, and would love to, continue the conversation. So thanks so much for having me, Rosa. It was great to be here and talk with another nurse.
Oh, it was so wonderful to have you. And for those of you who are listening, if you've enjoyed this episode, please do follow or subscribe wherever you're listening, or if you're watching on YouTube. If you are on social media, feel free to follow me at Nurse Rosa Speaks on all the different platforms. And you can also check out my website if you are interested in learning about the different facets of nursing innovation that I'm dabbling in right now. And that is nurserosaspeaks.com. So, definitely let me know in the comments or send me a message on my website if there's another topic or someone I should interview on this podcast that you'd like to hear more from, and you think they have great ideas and they need to be spotlighted out into the world. And I will see you in the next episode.